Welcome to my channel Puja's Physio. Today, we're tackling a serious medical emergency: meningitis. Meningitis is the inflammation of the protective membranes, meninges, surrounding the brain and spinal cord. When these membranes swell, it can disrupt thinking, movement, and even threaten life. Time is critical. If not treated quickly, meningitis can cause permanent disabilities or be fatal. Hearing loss, memory issues, or paralysis. In severe cases, the infection can enter the bloodstream, causing organ failure. Recognizing symptoms and acting fast can save lives. Imagine Alex, a university student. He thinks he has the flu, fever, headache, sensitivity to light, but rapidly worsens. His flatmate notices confusion and neck stiffness, calls an ambulance, and Alex gets urgent care. Meningitis often mimics less serious illnesses, making awareness crucial. In this video, we'll break down what causes meningitis, its symptoms, diagnosis, treatment, and the vital role of physiotherapy in recovery. My goal: empower you with knowledge, because being informed can make all the difference. Let's get started. What causes meningitis? Most cases are due to infections, mainly bacteria and viruses. Bacterial meningitis is more severe and life-threatening, requiring immediate antibiotics. Viral meningitis is usually less severe. Most people recover fully with supportive care. Fungi and parasites can also cause meningitis, but these are rare and usually affect those with weakened immune systems. Non-infectious causes include certain cancers, autoimmune disorders, medications, or head injuries. Treatment depends on the cause, so doctors work quickly to identify the culprit. Pinpointing the cause is the first step to effective recovery. How does a germ cause such chaos? It often starts with an infection elsewhere, like the sinuses or lungs, that spreads to the brain. Some bacteria and viruses can breach the blood-brain barrier and enter the cerebrospinal fluid, where they multiply. The immune system responds with inflammation, causing the meninges to swell. This swelling increases pressure inside the skull, leading to severe headache, confusion, and sensitivity to light. The pressure can damage brain tissue and nerves, causing lasting problems. Sometimes the immune response itself causes more harm than the infection. That's why meningitis is a true medical emergency. Early recognition of meningitis symptoms is vital. In adults and older children, look for fever, severe headache, and neck stiffness, symptoms that appear suddenly. Other signs include sensitivity to light and sound, confusion, drowsiness, nausea, and vomiting. A non-blanching rash, red or purple spots that don't fade under pressure, is a medical emergency. In babies, symptoms are less specific: high or low temperature, refusal to feed, unusual sleepiness, a high-pitched cry, or a bulging soft spot on the head. Babies may also be irritable or floppy. Trust your instincts. If someone seems more unwell than ever before, seek urgent medical help. Symptoms can develop rapidly, sometimes within hours. Never wait to see if things improve. Acting fast can prevent devastating consequences. 12. When meningitis is suspected, doctors act fast. They start with a physical exam and patient history, checking for fever, neck stiffness, and rash. The key test is a lumbar puncture, collecting cerebrospinal fluid from the lower back to look for infection. Lab analysis checks for cloudiness, protein, glucose, white blood cells, and bacteria. Blood tests, and if needed, brain scans help rule out other problems and guide treatment. Rapid diagnosis is crucial to start the right therapy. Combining these results allows doctors to confirm meningitis and identify its cause. Suspected bacterial meningitis is treated immediately with intravenous antibiotics, often before test results are back. Once the specific germ is identified, antibiotics are adjusted for maximum effect. Viral meningitis is managed with supportive care, rest fluids, and pain relief. Steroids like dexamethasone may be given to reduce brain swelling and lower the risk of complications. Fungal meningitis requires antifungal medications. Patients are closely monitored in hospital for vital signs and complications. Early, targeted treatment is key to survival and recovery. 10. Sometimes, meningitis leads to complications that require surgery. Hydrocephalus, fluid buildup in the brain, may need a temporary drain or a permanent shunt to relieve pressure. Brain abscesses or subdural empyemas, collections of pus, might need surgical drainage. These procedures help prevent further brain damage when medication alone isn't enough. Quick intervention can be life-saving. Surviving meningitis is just the beginning. Rehabilitation is often needed. Physiotherapists help patients regain movement, strength, and independence. Early rehab in hospital prevents complications like muscle contractures and chest infections. As patients improve, therapy focuses on rebuilding strength, balance, and mobility. Advanced rehab tailors exercises to individual needs, helping people return to daily life. For those with lasting issues like muscle stiffness or coordination problems, specialized techniques are used. Physiotherapy empowers survivors to reclaim their lives. The future of meningitis care is brighter than ever. Vaccines have drastically reduced dangerous bacterial meningitis cases. New diagnostic tools, like rapid PCR tests, speed up diagnosis and treatment. Rehabilitation is evolving with technology. Virtual reality, robotic exoskeletons, and advanced prosthetics are transforming recovery. Cochlear implants restore hearing for some survivors. Prevention, rapid diagnosis, and innovative rehab are saving lives and improving outcomes. Awareness remains our best weapon. Recognize the signs, act fast, and embrace medical advances. Meningitis is a challenge we can overcome. If you feel this video is helpful, then do subscribe, like, and help others by sharing.